name is Jennifer Hirsch-Romano. I work at the University of Michigan Medical Center. I'm currently an associate professor there. I am a deputy editor for the congenital section for Annals of Thoracic Surgery, and I started that position a year ago. The field of congenital heart surgery has seen a lot of changes in the past few decades. Mortality rates are incredibly low for the majority of congenital heart surgical procedures today. And so really the focus has gone from the surgical event itself to the overall aspects of all of the care that's involved in congenital heart surgery patients. So both the preoperative, intraoperative, as well as the postoperative length of stay. But more importantly, how all of that rolls into the function of these children long term and their quality of life. So we're seeing more and more push in the manuscripts that we're looking for, articles that really focus on how these patients are doing long term and how they're interacting with society and continuing to move forward beyond their focused interaction with the surgical field itself. I think the single most exciting thing that we're seeing in cardiothoracic surgery today is the tissue bioengineering, the potential to create valves and conduits that have the ability to grow with a patient, to be made out of their own tissue and cells. This is incredibly important specifically for my field of congenital heart surgery, in that many of these patients, we have surgical repairs for them, but they're left with conduits or valves that either will not grow with them or degenerate over time. So we're leaving these children with an ongoing lifelong need for repeated surgeries. And to have the ability to repair a child as an infant with a valve or a conduit that's made of their own cells that will continue to grow with them and won't degenerate and potentially avoid future surgeries would be revolutionary for our field. So I think it's always intimidating when you first submit a manuscript for publication, especially when you're relatively junior in your career. There's a big push to publish, but I think what's most important is really making sure that what you're actually publishing is something that you're passionate about and something that you've really studied well, so that you're making a contribution to the field. So I think my biggest word of advice for those who are getting ready to potentially submit their first manuscripts is really think about the research question and come up with something that you think is going to be new and innovative and really interesting to the readership, not just something that's going to be publishable. And in doing that, if it takes a little extra time to do that prospective study, to really get all the data elements that are really important and to really get some longer term follow-up on patients, the tendency is to want to complete a research project and get it published in a relatively short period of time. But putting forth that additional effort and getting some of that expanded information is what's going to set that publication apart from a lot of the other ones that are being submitted. My current research interest is, again, in functional outcomes for congenital heart surgery patients. Specifically, when you look at infants who undergo congenital heart surgery, even some of our relatively simple operations that may require a 1 or 2 week stay in the hospital, I was shocked to see how much of an impact this can make in their development and delay them, even the simplest things of sitting up or rolling over, and how those setbacks just snowball throughout their entire development. It can really lead to long-term problems when they get to preschool and school age. So my interest was trying to get a better way of being able to pick up these small deficits early on so that we can intervene earlier rather than waiting for them to become larger problems. So I've been working on creating a tool, or basically a metric, somewhat like a Glasgow Coma scale for lack of a better reference, but basically something easy that can be done at the bedside in about 10 to 15 minutes by a nurse, that can monitor on a weekly basis how patients are doing in the hospital and to pick up any declines in their development. One, it gives us that information to be able to refer them appropriately, but it also ultimately gives us a research instrument which allows us to track changes and then to try to impart an intervention in the ICU, such as simple things as proning babies or laying them on their tummies every day for a period of time, and being able to use this instrument to see if doing that intervention actually improves outcomes. So currently we're in the phase of validating the current tool to make sure that it really is predicting what we want it to do, and that it is dynamic over a short period of time. My hobbies right now is interior design. I think if I had in my next life, I'd come back as an interior designer. I've had a lot of fun spending the past 2 years renovating a 100-year-old Tudor house, both from getting into some of the structural issues as well as the design and decor. So that has been the thing that has been holding a lot of my attention aside from being a mom. But other than that, it's just basically spending time with my kids. We're hoping to get back into the garden with the kids soon as we get the house done, and teach my son how to grow some vegetables and cook in the kitchen and do all the things